6 numbers every allied health clinic owner must track to stay profitable. Hi, I'm Narelle, and I help allied health business owners hire and manage a profitable team of practitioners. I've helped hundreds of clinic owners go from money in, money out, not knowing where it's going, to knowing exactly how profitable each practitioner is. I remember what it was like when I owned a clinic, especially in the early days when we were growing and hiring our first few practitioners. We could see that there was enough money each week, but we had no idea how we were going to cover paying a staff member for leave when they were taking a week off and there was no revenue coming in from them. After spending 15 years working in corporate HR, I had to combine my experience having my own clinic with my corporate background. I've built HR and pay frameworks for businesses from solo clinics to large teams all across Australia. I see the same patterns over and over again. When clinic owners finally track the right numbers, their profit and peace of mind change almost overnight. In today's video, I'm going to give you clarity about the exact numbers that I used to track when I had a clinic that I help all of my clients implement when they're tracking their own numbers. These are the numbers that will show you whether your team's performing, whether you're paying too much, these are the sorts of numbers that will show you whether your team's performing, whether you need to make changes in your business, whether your charge rates aren't enough, whether your KPIs are too low, whether your wage bills are too high, and why your bank balance might not match your rent. And at the end, if you'd like a done-for-you spreadsheet to track these, so you don't have to start from scratch, you can grab a copy of my free profitability and KPI review sheet. I'll drop the link at the end. Let's be real, you can't fix what you don't measure. The clinics that do track these metrics can make decisions faster. Firstly, this is a simple measure of wage costs as a percentage of your revenue. Now, I know that historically in the industry, a lot of people are used to being paid commission structures. You perhaps worked as that when you had your first job. You perhaps even have contractors now and don't really know how to transition them to employment because you're so stuck in this mindset of paying commissions. But it is a really useful measure to track what percentage your employee's wage, including their super, is of their total billings. Generally, with clients that I work with, depending on the type of practitioners they have, they're expecting their wage costs for their practitioners to sit somewhere between 40 and 55% of billings. If it's creeping higher, you're probably either a little bit low in your billable hours or your utilization rates. If it's creeping higher, you're probably not billing enough hours per practitioner. This could be due to poor utilization of available appointments, not billing for all activities that should be billed, and this is definitely something I see with a lot of OTs, where the OTs are burnt out, yet the books are showing less than 65% utilization, often because they're answering queries that they should be billing for and they're not. It could be poor calendar management that leads to gaps not being filled. So like, for example, you book in an hour and a half treatment and then that creates a half an hour gap that you can't fill. There's no process to fill cancellations. So someone cancels last minute and people are scrambling and there's now a space in your diary. There's no process to fill cancellation. Or maybe you've set salaries and incentives that are too high and unsustainable without KPIs being met. If your wage costs are sitting lower than that range, your practitioners may be getting underpaid. Now, they may be getting more than the award states, but that's only a guideline. Realistically, what you want to do is make sure you position somewhere reasonable within the market so that you're attractive as an employer and that you have better retention. If you're struggling to hire new people or retain the people you have, low wage costs could be part of the problem. There are really smart ways to introduce incentive structures without blowing out your wage cost ratio. You just need to be really considerate of how your business operates and what's actually going to motivate your employees. Practitioner utilization is definitely the heartbeat of profitability. How much practitioners' paid time is billable is critical. If we're talking about physios and chiros, for example, we're often aiming for around 80% utilization of available appointments. Now, this metric is slightly different to that of an OT or a psychologist or a speechy, for example, who are talking about 65% billable hours. So realistically, when we're talking about 80%, let's say you have a 38-hour week permanent employee, they might work 34 hours a week that are actually available for appointments because the other 4 hours are set aside for training, staff meetings, catching up on notes and other admin work. So out of 34 hours, you're expecting them to be 80% utilized of that, which is roughly like in the early 70% of their entire working week as billable time. Now, something that some people don't consider is that to actually hit these targets, you may need to slightly overbook, and that's due to cancellations. So let's say you book out your OT for 65%, which is normally about 25 clients a week. So you book them in 25 clients, someone cancels, and then all of a sudden they've not hit their target. Realistically, what we used to do when we had a clinic, if we expected someone to see 5 clients a day, we would often book for 6, and maybe not every day, but over the week, there would be a couple of overbooked appointments, knowing that they may have cancellations and that overall they would still end up hitting the targets that we had set. The other option is if you have a really strong waitlist system and an admin team that are on the ball to make sure that these are filled straight away. It just depends on whether you see a lot of late cancellations or whether you have plenty of notice and the type of business structure that you have. Because I know in some areas, it may be much harder to bring in a new client at short notice as opposed to in other types of business. The third things that I often see people making errors with are not adjusting targets for leads. So when you're actually forecasting the annual revenue potential of your practitioners, you really need to take into account the fact that they will accrue 4 weeks of annual leave per year. And then they will not work public holidays that they are rostered to work. And they're also eligible to take sick leave. Now, there are about 10 plus public holidays, depending on which state you're in. So that's around 2 weeks. And then there's also another 2-week sick leave entitlement. Now, some employees may take their entire entitlement. Other employees may not access any of it. So often with clients, I look at roughly a 45-week working year, as in, so 52 weeks minus 4 for annual leave, 2 for public holidays, and about 1 for sick leave. If you want to be more conservative, you can take the 2 off for sick leave. If you offer things like a week's study leave, then you take that off as well. So it's really critical because if you think about this, and I'll just use a very simple figure. So let's say that they would be billing $2,000 a week, which is probably not. What would they be doing? If you just take a simple explanation of this, let's say that you expect that they'll bill around $4,000 per week. And if you work that out that they're going to work 50 weeks a year, you're going to expect that they're going to earn around $200,000 in billings. But the reality is if they're only working 45 weeks a year, they're only going to be billing, if I can do the math correctly, I think that's $190,000 a year. So that makes quite a substantial difference. If you want to do some comparisons on this, just think about it. If someone's billing, say, $4,000 a week, and you're estimating that they're going to bill $4,000 a week for 52 weeks a year, you're going to assume in your revenue projections that they will bring in about $208,000. But the reality is they're only working around 45 weeks a year. They're only going to bring in $180,000. So just be really clear in your forecasting so that you're not expecting a higher figure at the year end than what you actually end up with. And this is really critical for things like admin, for example. If you think that you're going to have $28,000 per additional revenue for that per practitioner, and that let's say you then have 3 practitioners, and that means you can cover an entire year's admin wages with that. So you hire an extra admin. You're going to be bitterly disappointed at the end of the year and wonder why you don't have as much money as you thought you would. Now, another really critical thing is when you compare the actuals that someone has billed at the end of the year, make sure you account for leave. I had a client recently who had a practitioner who they came to me and said, this person has asked for a raise. We're thinking about implementing an incentive structure. And when they sent me through their KPI tracker, one of the things I instantly noticed was that they're an OT and they weren't meeting 65% billable hours consistently week on week. And so I said to them, like, on what basis are you going to implement this incentive? Because you're telling me that your target is 65%, yet they're not hitting that. But then when they looked on the annual basis, it looked like they had exceeded the revenue target that was set. When we dug into it, they set their revenue targets based on 44 weeks per year. So they assume that employees will only work 44 weeks per year. And this employee had worked roughly 47 weeks in the year because they hadn't taken all of their annual leave or their sick leave. So they had more working hours available, which meant they'd exceeded their annual target. But the risk with that is they could take all of that leave next year and only work 42 weeks, for example. And you now think that they've exceeded their targets when they haven't.